Hi Sheila, this is Wendy Nixon, and I wanted to respond to your post. Thank you. It was an excellent post about the qualifications for test use. You mentioned the differing requirements by the test publishers, and I also was concerned that there is really not a clear consensus about the requirements for the differing levels, qualifications to purchase and use and administer the different A, B, and C level of tests. It seems like there is a consensus about the A level, but when it gets to the B and C level, that it becomes gray there. That I know some of the sources, the publishers say graduate degree or training. Our Gregory textbook, 2016, says of the level B, just graduate training. And I think that that certainly is a very minimum, would need supervision by a licensed professional. But I think that your follow-up point to that about ethical administration of testing is just a very excellent point and has to be really a key point in using any kind of testing procedures. I think that Gregory 2016, our textbook, gives an excellent, well, actually several excellent examples of this and warnings to be careful. One of the examples that I wanted to quote is on page 19, the case exhibit 1.3 about the candidate for a position as a police officer. She was denied the opportunity because her pre-employment screening MMPI was interpreted by a psychologist as defensive. Her profile was within normal limits, but the case scale on the MMPI, which tests for defensive, screens for defensive test taking attitudes, was a 72, and 70 or more is considered noteworthy. Apparently, what the psychologist did not know and was really a breach of ethics, did not know that the elevated K-scale scores are extremely common among law enforcement job applicants, and even moreover, successful police officers tend to have higher K-scale scores than problem law enforcement officers. I think this is a very important point that one, as a test user, administrator needs to not only know about the test, but all of the nuances and just really all the ins and outs of interpreting and what do the scores specifically mean, the research and literature, just to know the whole gamut of information about any test use. So really, as Gregory points out, this psychologist's ignorance was a breach of ethics and really resulted in serious legal consequences, a lawsuit that was settled for a lot of money out of court, because obviously that's whether one is hired in a job or not is a very critical, life-changing decision, and for that to hinge on a test, one test, and the interpretation of that is very serious. I had a example, also a concerning example. Soon after I graduated with my master's degree in 1989, I was working with a teenage girl who underwent some psychological evaluation and testing. She was found to be borderline IQ in the 70 range. And so her mom was given a copy of this test, of course, with caution not to let her see it, but um, the teenager did get the test and read it and was absolutely devastated by the fact that she was low, well, borderline IQ, and her interpretation of that and reading it and not having it explained, I'm sure really was more serious. But she was really depressed after that and struggled with that. So, I think that's another negative way that um, test results can impact people. Obviously, she should never have read that report herself. Um, but that definitely would be another caution. So, um, I guess in summary, I just feel like I agree that we have to be very careful. As a licensed counselor, I would follow suit with what you're saying in your post that um, I really enjoy using. I've been trained in some of the level B screeners, and I really enjoy those. I think that they give a lot of good information, and to use that not as a diagnostic tool in and of itself, but really as an adjunct to clinical interviews and other information. And I also would refer all level C testing to a licensed psychologist. So thank you so much for your post, Sheila. Take care. Bye.